Welcome to the video of muscles of facial expression. We are going to begin on page 261. We'll get to that in just a second. There we go. There we are, muscles of facial expression. We have quite a few muscles that produce different movements in the face and facial structure. We also have little teeny muscles that move the ear, and of course, little teeny muscles that tighten things, tighten fascia and skin in order to produce a variety of different facial expressions. We have these kinds of muscles because humans are face-to-face creatures. In other words, in order to determine how someone is truly feeling, we have to look at their face. You know, we do take into account body language as well, but it is the face that shows the true expression that they're trying to convey, even when they're actually trying to hide it. So we have all these little tiny muscles, most of them attached to the integumentary system. So they move the skin. So the skin of the cheeks or the skin around the eyes or something like that. The ones that attach to the integumentary system are called mimetic muscles. And what that means is that they mimic other facial expressions. And this is actually very important in terms of infant development, because an infant mimics the facial expressions of the person that is holding them or looking at them. So when you smile at an infant, they smile back at you and you're like, oh, that's so cute. Look, he's smiling. Oh, well, he's just mimicking what you're doing. We have part of our nervous system is mimetic as well, and that is biological. So we mimic the facial expressions of the people that we grow up with. So we learn how to use our expressions to convey what we're feeling before we can even speak. Now, the other muscles, of course, are skeletal muscles like frontalis and platysma and things like that. And of course, these are also muscles of facial expression, but they have more bony attachments, and we've already studied those. So let's talk a little bit about some of the types of muscles that we see here. We have orbicularis oculi and orbicularis oris. In the name, you see the word orb, which means circle. And then, of course, oculi is referring to the eye. Oris refers to the mouth, like oral. These are sphincter muscles. A sphincter muscle is a round muscle that, when it contracts, closes in on itself, okay? So in both cases, orbicularis oris and orbicularis oculi, these muscles close in on themselves. They contract in on themselves in order to produce movement. And orbicularis oculi actually closes the eyelid. So whenever something comes towards your eye really fast, like a spray of water or a bug or something, your orbicularis oculi shuts in on itself real quickly and you blink, okay? That is a survival thing as well, because obviously you don't want something hitting you in the eye because you may lose the eye. So orbicularis oculi shuts your eyes, but also can shut your eyes really quickly if necessary. Orbicularis oris is a sphincter muscle. It closes in on itself, but orbicularis oris does this. So it makes you pucker up like this, right? It brings your lips together in a ooh kind of motion, or a kissy kind of motion. So orbicularis oris is your kissy muscle. And again, it's only on the skin. So it brings the skin of the lips together like this. You can do fish faces and things, right? Entertain your family and friends. So those are orbicularis muscles. They are sphincter muscles and they close in on themselves. You also have these muscles called levator. There's levator anguli oris, levator labii superioris, anytime you have a levator muscle, it is going to lift something. Okay, in this case, you can see that they are going to lift the lips or lift the skin around the lips. Okay, so levator anguli oris here, levator labii superioris, those are muscles that help bring your lips up like this and form a smile. Incidentally, it only takes 8 muscles to produce a smile, but it takes about 20 to produce a frown. So yes, it does take more muscles to frown than it does to smile. And there you go. Zygomaticus major here and minor over here. These are also smiling muscles. They do pull the corners of the lips up, but I would like to point out that it's not enough for the lips just to be lifted up, because if I did that, I just lifted my lips up, I look a little crazy, right? It doesn't look like a genuine smile. The genuine smile comes from some of these other smaller muscles that are around the eyes and on the cheekbones, that when you smile genuinely, your cheeks move up, but your eyes smile. And that is how you know someone is actually being genuine versus just, right? That's a great joke. That's really funny, right? Not genuine. And you know that because you have experience with people being genuine and seeing their eyes smile, and people being disingenuous when they're just sort of humoring you. Okay. We also have muscles that actually go in between the eyebrows. This one is, well, there's procerus here, and then corrugator supercilii here, and then it's going to be over here as well. Procerus kind of brings your nose up a little bit, like when you smell something funky and you're like, ugh, right? The nasalis lifts, well, nasalis and a couple others lift up the nostrils, and then procerus actually sort of brings that skin together. Corrugator supercilii are the ones that knit your brows together. So when you're angry or when you're thinking real hard or concentrating, you get those lines right here. That's corrugator supercilii. So you also have some muscles that are, of course, on the mandible here, not just masseter. You have mentalis, which is here, or I'm sorry, mentalis, which is right here, sorry. Mentalis are these two. They kind of pull the chin down. And then depressor labii inferioris makes the lip go out. So that's how you pout. You use mentalis and depressor labii inferioris. I'm not very good at it. It's fine. It's fine. Whenever you see the word labii, it refers to lip. Okay. So depressor labii, you had levator labii. It's talking about the lips. So these muscles are going to affect the lip in some way. Okay. You have the muscle buccinator. It's pronounced with like a KS, buccinator. Buccinator actually brings the cheeks towards the teeth like this. So it tightens the whole fascia around the mouth and lips and brings it towards the cheeks. So if you have ever played any instruments, specifically brass or woodwinds, then you would know buccinator, because you really have to tighten your lips to get the air to flow out faster and at a different rate, or at different rates, so that you can make different sounds with your instrument. So if you haven't ever played a woodwind or a brass instrument, you probably don't know the buccinator. So anyway, there's a lot more here than just these, but these are the ones that your book focuses on, and they are on subsequent pages. So they are going to be 262 all the way to 269, talking about muscles of the scalp. And the little auricularis muscles. So there's our auricularis anterior, you have a superior and a posterior, and they actually move the ears. Now, auricularis just means little auricle, which means little ear. Okay, that's all that means. Auricularis muscles actually do work, and some people can wiggle their ears. It is difficult, but you can do it with practice. We just don't need to. We don't look at each other's ears for, to see how we're feeling. However, if we were a horse, we'd have 13 muscles that control the ears, and we will most certainly use our ears to determine how another horse is feeling or how we are feeling. So while we use face-to-face expressions, horses use ears to tell each other how they are feeling. And if you are familiar with horses, you know this to be true. You can see their ears moving all over the place when you're talking to them, or when they're in a new environment and they're trying to figure out what's going on. That is how they communicate their expressions. Humans just have the tiny little three. We're not very good at expressing our emotions through our ears. All right, so if we move on, we can see these here. There's auricularis superior, posterior, and anterior. And again, just little tiny muscles that move the ear. Okay. And you can see all of the other ones that we talked about here: zygomaticus, major and minor. Risorius, we haven't talked about yet. That one pulls the cheek to one side. You can actually see how it would do that. It pulls the lips to one side, like that. And as you go through these pages, it will individually tell you what the muscle does. So it'll show it, and then it'll give you the facial expression that it's associated with and things like that. That is all that I really want you to know about muscles of facial expression. I'm not interested in you learning the origins and insertions of them, only what they do. Okay, so their names and what they're typically used for. And down at the bottom, remember, you have the pronunciation. So buccinator. You have the pronunciation, and then you also have the meanings of each of these. Okay. So here's the levators. You can see how they lift the lips, right? Okay. All right, you can read through those. I am not going to go through all of them with you. We just basically went over them on that one page anyway. So that is it for muscles of facial expression. I will see you soon.